Okay, great. So good evening, everyone. My name is Monica Mandas, head nurse in Natuvitro, and welcome to my IVF Answers by the European Fertility Society. As I said before, this is actually my first time joining my IVF Answers, and I am truly happy to be here with my clinic, Natuvitro, a clinic based in Barcelona, in Spain. I see that there is some people that is joining us, so I'm gonna use this little time before starting the presentation that I've prepared for you today to present a little myself so you can get to know me a little better. So I'm an Italian nurse specialized in assisted reproduction and research with over 30 years of experience in the assisted reproduction field. In the research field, I've been the secretary of an ethic committee, and I focus myself on educational projects and to improve patient-centered care. And beyond the clinic, what I do every day in Natuvitro, I am a member of a scientific committee, and I coordinate the research and education group of the Spanish Fertility Society. And I also am teaching patient-centered care in the master's program in human assisted reproductive technologies at Universidad Pompeu Fabra in Barcelona. So let's dive into the presentation. Okay, so as you may already know, today we're going to discuss about egg donation in our clinic in Natuvitro in Spain, costs and process to understand better how we work here in this specific treatment. Okay, so just for you to know, this event is recorded, so you can go back to this video once my IVF Answers tomorrow will put it in the platform and on the YouTube channel. It is all anonymous, so you can ask all the questions you want, all right? So today we will start with a presentation that I prepared for this event on our topic, going a little more into the field of egg donation and specifically in Barcelona, in Spain, how we do it. And then we will have a moment, the second part of today, this 1 hour that we share together, to have a moment for all your questions, to open all the questions that you have for me, and I will try to answer to all the questions that you have. You can type any kind of questions you want. I am quite used to, as a nurse, to answer to all the questions after the appointment with the doctor. So I understand that there are some topics that you may want to understand better. And I also will give you all the contacts of the clinic, just if you need to go a little more further with some topics that you may want to discuss in private. Okay, so let's start with the topic of today. And before diving into that, I want to have a moment to speak a little about this treatment, because it is true that egg donation is a very difficult moment. It's more than a medical treatment, because it is true that it is a deeply personal decision that you have to go through when deciding to go to this specific treatment. And maybe it can be a highly effective medical treatment, we know it, and in some cases we suggest to go through this treatment, but it is a deeply personal and emotional decision for patients. So you have to go a step that may involve the loss of the genetic connection. And maybe even if it's the best medical solution, it's not the easiest personal one for you, because it is a decision that impacts your life plans, your identity, and the idea that you previously had of building a family. So you have before to understand this particular treatment and understand if you want to go through this treatment. And once you go through this treatment, we can help you through that. In Natuvitro, we understand that this treatment is delicate. It's a delicate moment for you, and our role is to support you through the entire journey. What we're going to see today together with the presentation and all the questions that you will have before and after the presentation is what the treatment involves for you, how we care for you throughout your journey, what costs you may expect from this kind of treatment, how our donors program works, and how we personalize each treatment for you, for the patients. But before we dive into the core of our presentation and about egg donation, I want to have the chance to show you a little more of what you will see, what you will find in the first appointment, the first time that you will arrive to our clinic. So from the very first moment, our patients tells us that it feels different at Natuvitro. It is true that since we thought about this clinic, we thought about every detail, and has been carefully designed to reflect who we are and how we care for you as a patients. When you enter in Natuvitro, you will feel warm colors, soft lighting, gentle shapes. And this is something that we want to transmit from the very beginning in the facilities, because we want to create the same sense of calm and safety that you will feel during your treatment with us. We want to avoid all this clinical coldness that we are used to see in hospitals and clinics a few years ago. We want to transmit comfort, discretion, sense of respect for the moment that you are going through. And of course, this is not just a choice of colors and aesthetics. We want to express our values with it, to personalize care, emotional presence, and the most important thing, human connection. The space in which you will be during all the journey, it's a reflection of how we see you. And of course, at Natuvitro, every part of our treatment or your treatment is handled with maximum precision and expertise. So scientific and medical excellence are our highest priority. Our lab is the first one in Spain, fully free of volatile organic compounds, the VOC, which are chemicals present in air that may affect the embryo culture and the first steps, the early steps of developing on the embryos. So we avoid all these kind of materials that may affect in the first early stage of the embryos. We also dispose of the most advanced equipment like embryoscope incubators, IVF witness for traceability and safety of our samples, and laser technology for embryo biopsies. We have our in-house operating room with private recovery rooms designed to transmit the same feelings that we were saying before, to make you feel calm and in a context of privacy that you deserve during your journey. Our team is made up of top-level fertility doctors, embryologists, nurses, coordinators, all specialized in the best European fertility centers and fluent in multiple languages. So we can follow up our treatments with patients from outside Spain. But for us, it's important that you won't feel like just another case. Behind every treatment, there is wonderful team. And Natuvitro, the people behind your treatment are just as important as the treatment itself. So from the very first conversation that you will have with our team, you'll meet a team of professionals that are not just only expert in fertility, but deeply, deeply committed to care for you as a person. So our doctors, nurses, embryologists, and coordinators work together to care for you as a person, not just as a patient. The mission that we share is to personalize your treatment and care, to listen to your needs, giving you all the emotional support that you need, to walk beside you through each step of your journey. Because we believe that human connection, and this is a fact, is just as important as medical excellence. So we take the time to build trust, to offer clarity, transparency, calm, to create this emotional space, environment where you feel like being in a family. And this is the feedback that we receive every day from our patients. So, there are so many clinics that you can choose to do your treatment in Spain and all around in different countries with the best medical team, with the best techniques, all the most advanced technology and protocols. But we really know through our experience that it's the people who create safety, comfort, and care. So what is our mission? To achieve your pregnancy in the shortest time possible, but ensure this process in a smooth, positive experience for you to remember. And let's go to the topic of the day, egg donation. You may already know something, but I'm going to explain you in details what is egg donation. It's an assisted reproductive technique where all sites from a healthy donor are fertilized in vitro and transferred to the uterus of the patient. When is that we recommend to go through egg donation? It is indicated when a pregnancy is not possible with the patient's own eggs due to many factors, which can be age-related infertility, women with low ovarian reserve, women with repeated IVF failure using their own eggs, or carriers of genetic condition they do not wish to transmit. Or also in Spain, you have to know that you can recur to egg donation in case of same-sex female couples or single women that they can achieve pregnancy with their own eggs, so they decide to go through egg donation for that. So these are all the options in all the situations in which we recommend egg donation to our patients. And let's talk about egg donors in Spain, who they are, these donors. So you must know that egg donation is strictly regulated by Spanish law. Donation is anonymous in Spain, voluntary, and altruistic. Donors are not allowed to know the identity of the patients and vice versa. Patients can't know the identity of the donors. And in Spain, there is a compensation for donors that is limited to cover inconvenience and expenses through the process. So who can be an egg donor in Spain? They are healthy women aged from 18 to 34 years old, and they must pass extensive medical and psychological screenings, including genetic history and testing, fluid blood work, infectious disease testing, STI tests, psychological evaluation, and gynecological assessment, like to verify the ovarian reserve. And once they do all this process, they go through all this process, we understand if they are candidates to donate eggs or not. And why? Why there are so many donors in Spain? I come from Italy. So in the beginning, I didn't understood how it was possible to have so many egg donors in Spain. I went from a different environment, and I think it's the same for you. There are several studies that showed us a little why egg donation is so common and normal in Spain. First of all, there is a they are moved by altruism, the desire to help others. You have to know that Spain has one of the highest donation rates in Europe, and this is not just only for eggs, but also for blood, for marrow, organs. This is a reflection of a strong culture of solidarity and altruism. It also happens to find many donors that have a personal connection to infertility. For example, someone in the family, between their friends, or with donation, the same. Maybe also some donors have to go through in the future to IVF treatment because they are in the same sex couple, so they have to go through IVF treatment to build a family. So they are moved by the same desire to build a family in the future, and they want to help in a certain way, so they decide to donate. There is also another reason why they donate, which is the economical compensation. You have to know that donors receive a legal compensation for the time, the effort, and potential discomfort involved in the process. You have to know that compensation is not a salary for the donors. It is regulated and aligned with bioethical guidelines. And there's also, of course, a mixed reason, altruism and economical compensation that can move donors to be donors. So once you decide to go through egg donation with Natuvitro, we start the donor matching process. So what we do, we select donors with your same physical and medical physical characteristic and medical compatibility, including physical resemblance. Like, for example, skin color, eye color, hair type. We do a genetic matching to minimize any risk of inherited condition, and a full medical and psychological screening, as we were saying before. Once we complete the history of the donor and we decide that she can donate eggs, we start the controlled stimulation of the donor that is performed by our medical team, ensuring an optimal response in the most safety situation for the donor. So once we arrive to have our eggs ready for the intervention, we do the egg retrieval performed under sedation in the operating room. Once we have our eggs in our lab, we fertilized using the ICSI technique. We can use the sperm from the partner or from a donor. It depends on the case in which we are. And the embryos are cultured in our laboratory. If it's necessary or it's the desire of the patients, we can do the pre-implantation genetic testing, which is called PGT. And what it means for you to go through this process. What is the treatment that the patient has to go through step by step? So the first thing that you have to do is to do a first free visit with a specialist in PMA in our clinic, which can be done in person if you want to know us for the first time, have an idea of how we work, who we are, and see the clinic for the first appointment, or remotely via video. If you don't want to waste time, if you have to work and you want to do it in your free time, you can do it by video. Your doctor will advise you based on your specific needs, of course, and we will decide what suits you better. So once the exams and diagnosis have been completed, we create a profile that includes your physical characteristics and, if it's the case, your partner. When you decide to start the treatment with Natuvitro, our donor team begin the search for a donor whose hair color, eye color, skin color, and physical constitutions are compatible with you. If you have a male partner, we will ask for a sperm sample too. So Once we are ready to, your medical history is complete and we have the donor, we can start with your endometrial preparation. So you can choose with the doctor for a natural cycle or medicated cycle to prepare the uterus and to prepare your endometrium. You can do the monitoring of the endometrium with us in the clinic. There are patients that decide to come here to Barcelona to do all the treatment with us, so we can do the ultrasound and blood test here in Barcelona. And there are others that prefer to do it in their own country to be easier, the organization. It's up to you, and we can adapt to all the options that you can choose. So we do the monitoring to ensure the optimal endometrial thickness. And once we achieve this thickness, the perfect one to transfer, we organize and program your transfer. The transfer has to be programmed in day 5 or 6, which means the blastocyst stage. If you're familiar with the word blastocyst, is the embryo in day 5 or 6 of development. And in this moment, only high quality embryos are transferred to maximize your chances of being pregnant in the end. So this is the best moment. Transfer is the best moment, I think, for both patients and the clinic, the staff, because it's a very emotional moment. And I feel like it's one of the most important one for patients and for the same team. Once we go through these phases, and once we perform the transfer, you have to wait until more or less 10 days to do your blood test to verify if you are pregnant or not. You can do it here in Barcelona with us, or you can do it in your home country and send us the results. Okay, so we are used to work with international patients. So if you want to do it in here, it's wonderful, amazing, and we are glad to have you here. But if you can't, it's all right, and we can do it by distance. So when we have to talk about success rates, it is important to be transparent, the most transparent possible, and show you the results, and depending on what is the situation. So in our clinic in Natuvitro, the chances of pregnancy offered by an IVF treatment with egg donation with an euploid embryo transfer after the PGTA testing are the highest among all assisted reproductive technology treatments. So I wanted to share you the difference with between the results without PGTA testing and the others with PGTA. In 85% of cases, we achieve pregnancy on the first transfer attempt with PGTA. You can see a great difference between testing and not, but there are already wonderful results even without PGTA, you know, but increases so much the chances of being pregnant from the first attempt going through the PGTA testing. After the second attempt, the probability of pregnancy is 95%. And after 3 attempts, this probability goes up to 99%. So these results are not just the lab or just the human connection or just how we do things. Is the combination of all the aspect that we take care of during your process. We are sure that all these aspects are giving these success rates in our clinic. So as I said before, the program more interesting with the best results is the one that includes PGTA. We have a treatment that already includes PGTA to identify euploid embryos, which means chromosomally normal. So we, in this kind of programs that we will see in a few slides after, we guarantee obtaining, depending on the program, at least one euploid embryo to transfer. Of course, having seen the results that we showed before, this increases the success rate and reduce for you the time to pregnancy. This kind of treatment, this kind of program is ideal for those patients who wants to prioritize safety, success in the first attempt, and top medical standards. And I wanted to show you a little which are the treatment costs in our clinic. I will show you on the left the prices, the treatment costs without PGTA testing, and on the right you will have with PGTA testing. So it's up to you, you can choose depending on your specific case. So without PGT, you have several options to take in mind. There is the first one of one blastocyst transfer guaranteed in your program. The second one in which you will have 1+1 blastocyst transfer included, or 1+1+1. There is also this other option of siblings, which means that you will have assured 3 transfer attempts with the same donor. So if you are already planning about having more children in the future, if you want to assure the same donor, you can choose this program with us. And with PGTA, as we said before, the best option if you want to assure the best results possible in Natuvitro, in which you will have the 1+1 guaranteed euploid blastocyst, which means tested PGTA, which means chromosomally normal embryo, another one to transfer, or 3 attempts included in your treatment costs. And there is also this other program, which is guaranteed pregnancy, that I'm going to show you after in a few slides, because it's a little different from the other one, and I want to enter specifically in this one. So what is included in all our egg donation programs? We personalize the treatment by the same gynecologist. From your first appointment, you will have your gynecologist and your specific medical assistant specialized in assisted reproduction. IVF witness security system that guarantees the traceability of the sample during the whole treatment process. All the ultrasound, as I said before, if you want to do the ultrasound and the hormonal analysis during your preparation at Natuvitro, is included in your treatment. Selection of the egg donor in accordance with Spanish legislation. Also the medication included and testing on the donor included. All the treatment for the donor is included in your treatment cost. Preparation of the semen sample, ICSI, embryo culture in the latest generation time-lapse incubator until the blastocyst stage, blastocyst transfer, pregnancy test performed at the Natuvitro clinics. Again, if you want to stay in Barcelona, you can do it because it's included in your treatment costs, and pregnancy monitoring up to the 8th week at the Natuvitro clinic. I also want to show you what is not included in your treatment cost, which is the co-carrier if it's needed, donor sperm if necessary, annual maintenance of the embryos that are not included in your program. If you choose, for example, without PGT 1+1, 2 embryos, the maintenance of the 2 embryos is included for the first year. After, you will have 300 euros to pay for the maintenance of the embryos. But it means too that if you have more than the transfer, the embryos of the transfer that you have included in your treatment costs, you also have to pay from the first year 300 euros for the maintenance of those embryos that you have from your egg donation cycle. So additional transfer that are not included in your treatment, and also if you have to take any medication during your treatment or do perform some medical tests, any other service not mentioned above is not included in your treatment's costs. And after that, we also have the guaranteed pregnancy that I was showing you before. So this is a very interesting program for patients that they want to be sure 100% that they are going to get pregnant. All right. So we offer a 100% refund in the event that a pregnancy is not achieved within 2 years from the first embryo transfer that you will perform with us. What is the difference? You have, for these 2 years, unlimited blastocyst transfers until a pregnancy of more than 24 weeks is achieved. And also you have included all the vitrification and maintenance of vitrified embryos for the first 4 years from the day of the freezing. There are just a few conditions that you have to take in account to select this program, which means that you have to perform minimum 8 transfers with us. But this is completely normal, and it's what we want. You know, if we are not achieving pregnancy, we are gonna try to have your pregnancy as soon as we can. So it's normal to go through this minimum of 8 transfer if it's the case. And if there is a case of miscarriage, after the 6 weeks, you have 3 more months to recover from the miscarriage to achieve your pregnancy. So this is an interesting program if you want to be sure 100% that if it doesn't work, that we of course hope not, you have 100% refund of the cost of your treatment. And this is more or less what I wanted you to know, resuming a lot about egg donation. Thank you very much for being here today with me. Now I will open space to the questions that I think I didn't close. So I already received a lot of questions that I was seeing when I was talking with you. But well, it's the first time, as I said to you, that I was using this platform. Maybe I made a mistake. So I would just wanted you to know that we have our website, natuvitro.com, in which you can enter easily to take the appointment with us, leave a message, or you can directly call us. If you directly want to contact to us without entering in the page, you have the email address info@natuvitro.com, and also our number here in the screen, so you can contact us if you have any more question or if you want to take the appointment with us. And I also suggest you to go to our Instagram page, Natuvitro, in which all the team create some very, very interesting content for patients about all the trends in assisted reproduction right now. And myself too, I did several videos regarding all the treatment medication that you have to do through the process. So thank you very much for being here today with me. I will open the chat so I can see all the questions that you have for me. And I'm gonna put the screen in the other way so you can see me better, all right? Okay, so I have a lot of questions in here. Everything is working, hello, thank you. So I see the first questions that I have in here. Excuse me, from Ray. Excuse me, do you have any Japanese egg donors? Thank you, Ray, for the question. Yes, we can have Japanese egg donors, depending on the kind of donor. We will need more time to find it, but it's quite easy for us. You know, Barcelona is a very international environment, a multicultural city in which we can easily find different donors with different backgrounds. So yeah, we can have Japanese donors too. And let's see. Okay. I can see too also this other question from Rini. Hi, please, do you have access to egg donors from Black Caribbean, Black African egg donors? Thank you. Thank you, Rini. So yeah, this is the same answers as before. We also have a lot of donors with this phenotype, so it's easy for us to find for you a donor. Of course, we can. Okay, so I have another question, a more difficult one from Grain. Hi, Grain. So, chances of conceiving using egg donor after having bowel resection for endometriosis. Already had one failed around using egg donor prior to bowel resection. Thank you very much, Grain, for the question. Is a more difficult one. I think in this specific case, you have to discuss with the doctor about your personal situation. So I suggest you, in this case, to take the appointment with our clinic, to call to our clinic and talk directly with the doctor, an online appointment in which you can specifically explain your case, your situation, and he can give you the best option, knowing better your background. So let's go. There are a lot of questions. Let's see, to try to also find other kind. Okay, Natasha, what medical, genetic, and psychological screenings are performed to egg donors? Thank you, Natasha. So, as we said before, they are going through any kind of test, like STI test, infection, all the tests that we usually do, even if we are going through IVF treatments, we perform it to the donors too. We do carriers to verify if there are some genetic condition that we have to take in count in the matching with our patients, and psychological tests for the donors to be sure that is ready, to go through egg donation. So I think it's Natasha again. Can I choose a specific characteristic of the donor, physical traits, blood type, educational background? So Natasha, normally it's not that you can choose. We respect your physical characteristics. You can choose to have, for example, blue eyes if you have green eyes or brown eyes, but we respect your phenotype to choose the most resemblant donor to you. And you can choose blood type, but in the end, you can choose to have concordance in the blood type, but it's not so important as it was before because there are so many genetic testing that people can do at home, and so if there is not that genetic connection that before we want to protect, this information, we want to protect it from the people that were born by egg donation. It's so easy to arrive to that information right now. So there is no reason to have to say the concordance of the blood type. And the educational background too is not something that in Spain you can choose to decide. It's we just respect the Spanish Fertility Society indication and guidelines to apply to our egg program. So let's go through the other questions. There are many that I already answered. There are some that are repeated. So we have Natasha that asked specifically the cost of PGT. So as I showed you before, there are several programs and treatment costs that include the PGTA testing. So you already have it. You can go back to the presentation as we are showing the presentation tomorrow, and you will have it on the YouTube channel. You can go back on the presentation, or instead you can go to our webpage and you can see all the prices with all the details of these programs. So let's go. There are so many questions. I'm glad that you felt free to ask, but there are some that are repeated and I don't want to repeat myself. Okay. Judy asked to me, I am 57. I will like egg donation and have children. I am healthy. Thank you, Judy. So in Spain, it is not allowed, it's not legally allowed to go through an IVF treatment after the 50 years. So you can't, unfortunately, go through this treatment. I'm sorry. Okay. Audrey asked to me if we have any emotional support for patients. Thank you very much, Audrey, for this interesting question. So we already start with personalizing the treatment. So this is something that is really important because as you will already have from the beginning, your coordinator and your doctor, this already do a big part in making your treatment easier, emotionally speaking. We also have other initiatives in the clinic, like for example, if you go through our page, Instagram page and our website, you will find that we organize this interesting event, which is called Women's Circle. Now we do it in Spanish, but we are thinking about doing it in other languages too. So for international patients that stays here in Barcelona for all the treatment, we can arrange also the Women's Circle in our clinic. This is a moment in which our wonderful coordinator, Julia, organize a moment for women that are going through fertility problems, or they are doing the treatment with us or with other clinics, or they are thinking about going through these treatments, share emotions and feelings about what they are going through. It's a very open space and respectful place in which each and every one of the patients can be free of talking about this difficult topic to share with the people around, because there is so much that creates this problem in sharing the emotions and the reality of going through infertility treatment. So we organize this wonderful women's circle. We also have the option of having an appointment with our psychologist in the clinic, and we also can recommend you psychologists in your specific area if you are from outside. More specialized in infertility and assisted reproductive treatments. We also can give you relaxation session. We can also arrange some session before the embryo transfer, for example, which is a more delicate moment in Barcelona. We can organize acupuncture, holistic therapy. We can organize many interesting appointments for you to be prepared for your transfer during your treatment. So let me see. Wow, I have Mary here. Wow. Mary showed a lot of information, personal information, and I think in this case, as I said before to another patient, it is better to take the moment to have an appointment with the doctor because it's gonna help you more than I can right now. I can give you, I can't give you a diagnosis and the proper information for you. So please reach us directly with an email to Natuvitro, and we will arrange an appointment with the doctor as soon as you can. So more questions, and maybe I will give you also some of the questions that normally our patients ask to us. I've prepared some in case you you don't have more questions or you want to know a little more because we have a lot of time. So for example, most of the patients wants to know how long do they need to stay in Spain for the treatment. So typically, we need you here in Barcelona between 1 and 2 days, depending on the treatment plan. But many steps of your treatment can be coordinated remotely before your arrival, so we can arrange all the appointments before. But the most important thing that we need is to plan, of course, if there is a partner, a first appointment in which you have to leave your sperm sample and do the genetic test for the male patient. And the second one, the transfer. So for the transfer, we always ask to our patients to be in Barcelona 1 day before, if it's possible. You know, it's ideal to be here in Barcelona 1 day before, so you are emotionally prepared and you are more comfortable here in the clinic, and you can see us the same day of the transfer, but staying here in Barcelona 1 day before. But if you can't, you can arrive the same day of your transfer. We will perform an exam, a blood test, an hormone test before your transfer to verify your progesterone levels in blood. So we need you to arrive more or less 3 hours before your transfer minimum in our clinic, so we can do the exam and we can have the result the same day of your transfer. We will anyway perform the transfer, there is no problem, but we want to be sure that your progesterone levels are correct. And so if the doctor has to adjust the dose or give you another kind of treatment, we can have the treatment done before you leave in Barcelona. And the same day of the transfer, you can go back home. There is no reason why to stay in Barcelona the same day of the transfer. You can go back, you can travel back if you have to go back home. But if you want to stay in Barcelona just to relax a little more, is also indicated. There is no contraindication in both circumstances. So let's see. Mary asked to me, how do I make the appointment direct with the doctor, please? Thank you very much, Mary. So you have many options. So you can choose to go through our website that I showed you before, natuvitro.com. So you can enter in the area in which you can make the appointment, click on that, and you can choose the ways in which you want to contact us. You can contact us by email, giving to us a little your history, a few details, all the information that you have, and we will arrange an appointment. As I said before, directly in the clinic or with video, so you can choose the best option for you. And the times are very short. You can have the appointment in a short time, so you can discuss with the doctor the best option for you. And let's see if there is okay. So Marin asked to me, can we request the donor to do extended genetic panel? I may need to return for a blood test if they have not done extended. Usually, thank you very much, Marin. So usually, if you already have done your testing and you want to go through the extended genetic panel, you can laboratory. You authorize the laboratory to have a part of your blood in case in which we have to do several studies, other studies more after. So there is no need to do again your test if you already have done it and you have to go through testing. But yeah, we can perform it. Okay. And I have another question from Gabriela. Hi, Gabriela. If I have adenomyosis, how I prepare the uterus? So in this specific cases, the doctor chooses to you the best option again, and will give you the best treatment that you will have. But it's possible. It's possible you can do your preparation with us. Just again, in specific cases, I suggest you to call to the clinic and take the appointment, and they will explain you better based in every situation of every patient. So I'm going to check again on the. So I've spoken to you also about this little difference that we have in our laboratories, which is the absence of volatile organic compounds, and this is something that can have a very big importance in the first steps of the developing of the embryos, the air quality of the laboratory. In embryology labs, we work with embryos in the most delicate early stages of life, and at these points they are very, very sensitive to the smallest changes and environmental factors, including the VOC, that are chemicals that are released into the air from many common materials that are used also in construction, like glues, paints, cleaning products, or even perfumes. In most places, we don't notice them, but in an IVF lab, it's very important because they can affect the stability of the culture media and potentially interfere with the embryo development. So we decided to create our lab 100% VOC free. This what it means. It means that during the construction of the lab, we avoided any material that could emit this kind of volatile compounds. So we always use a specialized air purification system, and we select to every piece of our lab, taking in account that we have to avoid this kind of materials and compounds. So this is something interesting and an added value that we have in our laboratory. So Rini asked me another question. Do you work with and have had success with women who have endometriosis? Yes, thank you very much. Yes, we had in our clinic a lot of patients affected by endometriosis, and our same medical director, Dr. Iñaki Gonzalez, is expert in this problem, in this illness. So yeah, we treat, and we have many patients that have endometriosis, and we can do the treatment too with this kind of patients. So another question maybe, or I can go. We have 5 minutes more, so I will find some of the questions that okay, I have a question, so I'm gonna go to Lina that gave me the question. Okay, if I remember correctly, you mentioned about a gene test. I don't mean the PGT test. I'm just curious. In general, do you know how often do you get a gene match from the gene test? Do you need to choose another donor? So I think you are referring to the Q-carrier test, which is the test that we perform to all our donors to detect whether they are carriers of inherited genetic conditions. These are conditions that can be passed on to children if both the donor and the sperm source carry mutation in the same gene. So if we go through egg donation with a patient that has a male partner, we also perform the genetic testing, this gene test, which is the Q-carrier test, to verify if there are certain conditions, carriers of certain genetic condition in the patient. So we have to do the matching with our donor, considering if there are the same carriers for the same genetic conditions. So we can't, of course, do a matching of a donor, of a egg donor, with the same carrier for the same gene. This is why we perform to all our patients the genetic testing, and to all our donors to do the matching. So the carriers can donate in the end, because there is no limit, but only if they don't have a critical illness, of course, a critical mutation of the gene, and if they don't have the same carrier of the patient, if they have it. I hope I answered the question. I want to tell you in this 2 minutes that I have, that we don't use, this is one of the common questions that we receive from patients. We don't use AI for doing the matching of our donor with the patient. It can be a very interesting tool in certain situations, but we don't believe it's the best option in this specific procedure, in this specific case. Our matching team will do the matching of the donor, which counts on gynecologists and biologists to choose the best physical matching and genetic matching for you. I don't know if there is space for one more question. We have 2 minutes. I wanted to thank you again for being here today so late on Monday. I've been very glad to answer to your questions. If you have more questions, I want to tell you that we can receive all these other questions that you might have through our website. You can reach us with info@natuvitro.com, and you can take easily free cost first appointment with us, so you can have more details about all the costs, different costs for different techniques, and assess you the best way possible. As I said you before, we personalize, and we know that it's very important to personalize treatments, and it takes so much courage to go outside from your country to do your treatment. So we know the importance of having a good follow-up through the process. Our time's up. Thank you very much once again of being here with me today. I hope I have answered to all your questions, and see you soon. Bye-bye.